Hi, my name is Dr. Scott Conard. I'm a family doctor. I've been practicing for over 20 years. It all begins with one cell. You may not realize it, but the cells in your body reproduce and they have to replace cells that die again and again and again. Now, at some point, one of these cells can become affected. And that single cell goes to 2 cells, then 4, then 8, 16, 32, 64. You get the idea. And the cells grow out of control. Now, depending on where this is in your body, you probably won't feel this. But over time, it will grow to the point where it can grow into other organs or it can spread. Many experts feel that it's 200 to 300,000 cells before you can actually discover it or feel it. If it's on the skin, maybe that's easier, but most of the time it's inside your body, and that's why it's very difficult to feel. So, if you think about 1 going to 2, 4, 8 every 14 days, it could be as long as 5 years before it gets to the point where you can find it. And that's the 5 years where we can find it, we can do something about it before it spreads. Now, there are things we can do to prevent cancer. Avoiding extended sunlight, maintaining a good diet, avoiding too much alcohol, not using tobacco products, and so forth. These are all important and things you definitely want to try to do. But even trying to do those things, 30% to 50% of us will develop cancer in our lifetimes. And in fact, it is the #1 cause of death for people less than 85 years of age. So it's important to try to prevent it, but it's also important to watch for change and to make sure that you get the test to discover it early. Stage 1 cancer, often cancer can be cured in a 5-minute to a 30-minute procedure. In stage 2 cancer, it's grown further, so you have to have the initial procedure and often chemotherapy or radiation therapy to make sure all cells are dead. Stage 3, it's even more, and sometimes you have to have both chemo and radiation therapy. And finally, in stage 4, it's spread to other parts of the body. All things we can do need to occur, and the likelihood of survival is significantly less.